Today, we're going to talk about something a lot of us feel, that deep, dragging exhaustion that just will not go away. It might be more than just being tired. We're talking about something called lethargy.
You know that feeling, right? Like you are just running on empty. I mean, so completely drained that even thinking about getting off the couch feels like a monumental task. Yeah, we've all been there. But what happens when that feeling just doesn't leave?
Well, that's when it might be more than just being tired. It could be something called lethargy. And trust me, it's a whole different ballgame than just feeling sleepy after a long day.
So let's get right into it. What exactly is lethargy, and how is it different from just feeling worn out?
Okay, so think of it like this. Tiredness, that's totally normal. It's your body's way of saying, hey, I need a break. You get some rest, and you bounce back. But lethargy, that's a whole other level. It's this deep, intense state of exhaustion that just sticks around. You feel drowsy, you kind of don't care about anything, and no amount of sleep seems to actually fix it.
So what are the signs? Well, we're talking a severe lack of energy. You've got little to no motivation. You're super drowsy all the time. You just feel blah, apathetic. You might even notice your brain feeling a bit foggy, right? Like your reaction time is slower, and you're having a really hard time concentrating or remembering things.
This brings us to the big question. Why do I feel this way? What's actually causing it? Let's dig into some of the reasons. A lot of the time, the answer can be found in our lifestyle. You know, the usual suspects. Sky-high stress, not getting enough good sleep, a diet that's, well, not so great. Or maybe you're not getting enough exercise. Even things like boredom or using alcohol and drugs can completely zap your energy.
But sometimes, lethargy is like the check engine light in your car. It's your body's way of telling you something more serious might be going on. It can be a symptom of so many things: depression, low iron, a thyroid issue, sleep disorders like apnea, or even things like diabetes and autoimmune diseases.
And hey, let's not forget about medications. So many common prescriptions can cause this. We're talking sedatives, antidepressants, even your daily allergy pill. Beta blockers, sleeping pills, you name it. So if you started a new medication and suddenly felt your energy tank, that could definitely be the culprit. Okay, now I want you to pay attention to this number, 6 months. Why is that so important? Well, when that deep, unrelenting fatigue sticks around for that long, it's a huge clue that we might be looking at a very specific long-term condition.
And that brings us to something called chronic fatigue syndrome, or CFS. Basically, if you've had this extreme exhaustion for at least 6 months and doctors have ruled everything else out, this is often the diagnosis. It's a really tough, debilitating condition, and right now there's no known cure.
I know, hearing all these possible causes can feel a little overwhelming. But don't worry, doctors have a really systematic way of figuring things out. It's kind of like detective work. Let's walk through how they make a diagnosis.
It's usually a 3-step process. Step 1, they're going to talk to you a lot about your symptoms, your lifestyle, and every single medication you're on. Step 2 is a physical exam. You know, checking your vitals, your overall physical and mental health. And if they still need more clues, they move on to step 3, further testing. This is where they might order blood tests, a urine test, or even something like an MRI to really see what's going on.
Okay, so we've talked about the what and the why. Now, for the most important part, what can you do about it? Let's talk about building your toolkit for getting your energy back and feeling better.
Now, assuming there isn't a bigger medical issue, there are so many things you can try at home. And honestly, it's all about getting back to basics. Are you getting enough good quality sleep? Eating a healthy, balanced diet? Drinking enough water? These things are huge. And so is regular exercise, finding ways to manage stress, like yoga or meditation, and maybe cutting back on things like alcohol and smoking.
But, and this is a really big but, please talk with your doctor before you make any major changes to your diet or medications. Seriously, don't just start or stop something on your own. It's so important to get that professional advice to make sure you're being safe.
Okay, so when is it time to stop trying things at home and actually go see a doctor? This is super important. Let's talk about the red flags you need to watch out for.
First off, just know that if you're feeling this way, you are definitely not alone. It turns out that about 5 to 10% of all doctor's visits are because of fatigue. So yeah, it's a completely legitimate reason to make an appointment. And you absolutely need to see a doctor if your fatigue comes with any of these things: confusion or blurry vision, feeling dizzy, sudden changes in your weight, or constant headaches. And especially if you're having any thoughts of self-harm, that's an emergency. Other signs, like insomnia, constipation, or always feeling cold, could also point to something specific like a thyroid issue that needs a doctor's attention.
So, to wrap this all up, remember this.
That feeling of being so tired isn't just noise. It's your body trying to send you a message. The real question is your body trying to tell you something?